Some people want to know why I invented the LANAP protocol. Actually, I don't know that I invented it in so much as LANAP invented itself. But it was really seeing the result in patients of new bone forming in places around teeth that are considered impossible to fill, especially in what's called the root furcations, the areas between the teeth. My rationale was if I could see that response once in one patient, why wouldn't I see it again in another? So I began to see that same response of bone fill in one patient after another, after another, after another. So now I was on a quest to find out how I could do it every tooth, every pocket, every time. Putting the patient first was about figuring out how LANAP could best serve them and how we could best drive that success rate from 66 to 96%, which is what we were able to do eventually. And we now have published data that shows that success rate, and also FDA clearance that validates the healing response isn't just bone fill, which is nice, but it's actually the regeneration of the entire attachment apparatus, which is the cementum or root coating, the ligaments that hold the tooth in place, and the bone that the ligaments are attached to. There was no thought, no imagination at any time to commercialize it. And it wasn't until probably 1996 or so when a patient challenged myself as to what I was doing to share this with the profession. And I said, I'm not, and I don't have any plans to. And I said, why are you asking? She said, well, I have a sister back east who needs this treatment. It's worked out very well for me. I'd like to see her have it performed on her. And I said, well, why don't you see that she flies out here and we'll treat her? And she says, well, she can't because she's a quadriplegic. And that stuck with me and bothered me for quite some time. It changed the way I thought about what I should be doing. And it was that patient and that conversation that led me to reach out and be more responsive to those that asked me about doing research, that led us to do research in 1998 and 1999 with Professor Ray Yukna from Louisiana State University, who completed the very first human histology study, and which showed that every tooth that was treated with LANAP had a positive response of new attachment, new cementum, and some bits and pieces of bone. And we think that we would have seen more bone had that study gone longer than 3 months. And we later repeated that study with a different investigator, and indeed at 9 months we saw a lot more bone. And that's what led to the true regeneration clearance with the FDA. So that's it in a nutshell. It wasn't anything I set out to intentionally do. I didn't have that foresight. But I did what was in the patient's best interests, and then I followed that pathway to where we are today.